We are delighted to be able to present during today's session. I have really esteemed colleagues here from Blue Cross Blue Shield of Arizona who are going to help us talk about the importance and opportunities around discussing substance use disorder, opioid use disorder, and how that applies in the workplace. And so there are examples we are going to share with regard to what we're doing here at AZ Blue, but we also welcome everyone's dialogue. As Paige mentioned, there is the question and answer box open throughout the course of our presentation. We encourage you to drop in a question throughout so we can make this a much more interactive session. With that, I'm going to ask my esteemed colleagues to introduce themselves. I'm happy to kick us off, though. I'm delighted to be here. My name is Christine Bracamonte Wiggs, and I am Vice President for Community and Health Advancement here at Blue Cross Blue Shield of Arizona. I also have the privilege of serving as president of our foundation. I'm joined by both Dr. Mark Carroll and Dr. Jasleen Chhatwal, and so I will ask each of them to introduce themselves. Dr. Carroll, do you mind joining?
Thanks, Christine. I really appreciate the opportunity to be here today. I'm Mark Carroll. I serve as the Chief Medical Officer for the Medicaid plans at Blue Cross Blue Shield of Arizona, and I'm honored and privileged to serve on the board, working with Christine for the foundation. Thanks.
Dr. Chhatwal.
Hi, everybody. Good morning. I'm Jasleen Chhatwal. I'm a board-certified psychiatrist, addiction medicine, and integrative medicine physician. And possibly a recent addition to Blue Cross Blue Shield, and I'm one of the behavioral health medical directors in the Medicaid plans for Blue. Thank you for having us.
Wonderful. So for everyone who's joined us, as Paige mentioned, this is the final installment of 3 different virtual sessions. So if you've had the opportunity to attend previous sessions, you've heard some personal lived experience around the importance of the topic of opioid use disorder, the biological chemistry of addiction, and opioids were also part of what you might have heard. And today we're really going to talk about several important topics around this critical conversation. So we're really going to highlight what we from AZ Blue, but others are seeing in this space as it relates to opioids. We're also going to talk about what we as insurers, why we believe it's so critical to address this important issue. We're going to share what AZ Blue is doing to help address both stigma as well as opioid use disorders. So we feel really strongly that addressing stigma is a key component to supporting and addressing opioid use disorder. We're also going to discuss how employers can support their employees as they are finding the right treatment options out there, and how employees can navigate to find treatment options and resources as well as support for themselves. And then finally, we're going to share how AZ Blue is supporting our own employees, and then highlight the toolkit that was developed by Valley Leadership and others to really support other employers in this space. So again, welcome you to drop your questions into the chat box or question and answer box as we move forward. But we're going to begin with what we are seeing in this space as it relates to opioid use. And so I wonder, Dr. Carroll, if you might kick us off here.
Yeah, happy to. Thanks, Dr. Wiggs. And hey, special thanks to Paige and Valley Leadership, the Impact Maker program. Phenomenal program that you're putting on yesterday and today. And most importantly, your leadership in this important topic and in other key topics, promoting and engaging leaders from across the Valley in hard and challenging problems that together we can resolve. If you had the opportunity to see some of the presentations yesterday, we will be synergistic with those and won't repeat. But the first 2 data points are really important for us to repeat here and to start with. And it frames how we look at this through the lens of health solutions and health insurer for Arizona. 5 Arizonans are dying every day from opioids. That statistic has remained about the same for a few years. And unfortunately, it has not decreased during the pandemic. And that's 5 Arizonans too much each day. 7 out of 10 pills, and we'll share a bit more information in a second, that are seized by the DEA, the Drug Enforcement Agency, contain a lethal dose of fentanyl, and we'll show you a picture in a second of what a lethal dose looks like. That's 7 out of 10 pills that are just seized from the streets in their work. But that action makes a difference. Hard problems, difficult problems they require us to work together collaboratively and with collective action. Because there is best practice, and we're going to share some of that with you today, which is what brings us to this conversation as a partner and collaborator so that we can make a difference. Data is available from our experts in the state at ADHS on both opioid prevention, but as you can see here, it lists more than just the 5 people every day that are dying from overdoses in Arizona. But there's a dashboard below around the number of people who are seen and treated. And that's something that's kept up to date. That's a resource for you to look at collectively. And the state, and this slide is from the Arizona Department of Health Services CMO, Dr. Lisa Villarreal, who kindly shared some information with us for the session today. But this is not all about fatalities, too. As you can see here, every day, 9 Arizonans are cared for with non-fatal overdoses. And while that number of non-fatal overdoses has come down since its peak in 2020, it is still quite high and double what it was in 2017. This is the slide that I think is so important visually for me. This took some of us, this got our attention and continues to get our attention. The amount of fentanyl that's required to create a death, a lethal dose, is the amount that's shown there on a magnified pencil point tip. It is not very much, and most pills that the DEA and others in law enforcement are seizing from our streets actually have such a lethal amount. Dr. Chhatwal, did you have any comments or additions to just where you're seeing and the experience of the community around fentanyl?
Yeah, as a clinician in the community, I think we noticed that fentanyl is prevalent everywhere. And I think it's good for people to understand what a lethal dose looks like, because it's not only present in pills that are labeled as opioids. So if somebody's trying to get pills off the street for opioids, they typically do have fentanyl. But we're also noticing that folks who are using substances like marijuana or sometimes even psychedelics, or they might be thinking they're getting benzodiazepines off the street. Whenever they're getting something that's unregulated, there's a very high chance at this point that any substance bought off the street will contain fentanyl. So there are fentanyl test strips that our public health experts are distributing. And for anybody who's using substances off the street, having those strips that test can be life-saving.
Thank you.
So the next series of questions are really going to be, our topic is really going to be around why we as an insurer, AZ Blue, why we believe so deeply that addressing this issue is so important. And so I'm going to ask Dr. Carroll, do you mind kicking us off again in this section?
Yeah, I'd be happy to, thanks. And we shared those initial bit of information just to have us always be grounded and level set in what the reality is day to day. And it is that one pill can kill, and sadly does. And many of us have lost people that we know or folks from our neighborhood who sadly succumbed because they had one pill and they may not have even known that there was fentanyl in it. But from our standpoint at Blue Cross Blue Shield of Arizona, we're about inspiring health for not just our members, their families, and the community, because we are part of the community, and so we all have a role to play. For us at Blue, this includes supporting members and families, but beyond that, educating our clinical care partners in the community and expanding and improving timely access to services for our members and the community through timely information sharing, our coverage and benefit decision-making that often is done in collaboration and partnership with employers such as some of you, grants through our foundation and our other philanthropic efforts that Christine leads for service innovation, implementation of best practices. We'll talk about some of that. And partnerships with you all and with the community, working collaboratively and moving forward. Really importantly for us, Inspiring Health is about sharing positive messages of hope and action in the face of challenging difficulties that are based on evidence and best practices. And we're going to share some of those with you now. So hope is important. And that hope is beyond images, and it's hope of making a difference, as that image showed. And what we've tried to do thanks for sharing that hope image there. That's actually from a collaborator, colleague of ours, Dr. Sarah Gibson, who's an expert in mental health and substance use care in the state. But we've really tried to embrace this approach to hope with action, and having that action changed numbers and the narrative. And at Blue Cross Blue Shield of Arizona, under the direction and guidance and leadership of Dr. Kara Christ, our Chief Medical Officer for Blue Cross Blue Shield, our behavioral health action plan is working to do just that. This slide gives a sense of some of the activities that are going on at a high level with our behavioral health action plan that our organization under Dr. Chris' leadership developed. First and foremost, and we'll talk about that in a second, is to reduce stigma, to increase awareness, build a network that is strategic and responsive to needs, make it easier for our members to access care and resources. We can chat about that. We'll talk a little bit about support for our young people, teen and young adults, and youth mental health, connecting folks with lead for those who are in need, but engaging people. And we set ourselves a pretty high bar of engaging over 500,000 Arizonans improving behavioral health, and we're well on our way to accomplishing that. There are national best practice guidelines for the use and the treatment of folks with opioid use challenges. These, just as a screen grab from the CDC, these are important reminders for us as an insurer and how we become involved of collaborating with our clinical provider community and network of providers to actually advance, continually talk about best practices and how we incentivize their use for the initiation or lack thereof and non-initiation of opioids. There are non-opioid treatment approaches, duration of opioid use, what opioids are selected, and then harm reduction. We're going to talk a lot about harm reduction today. Those best practices include guidelines that are developed nationally, such as the image and the link here for SAMHSA on clinical guidance for caring for pregnant and parenting women who might be challenged with opioid use disorder and their infants. Best practices exist. They're developed in our state, they're developed nationally, and we're very much committed to working with our clinical partners and our community partners and organizations to implement them and share them as widely as possible. We have been involved in educating, and this is a key part of our role. It's not just contracting with providers to deliver care across the state, but it's training and it's education and it's learning together in an all teach, all learn approach. We've been doing this for a number of years, and in the Medicaid segment in particular, and now across AZ Blue, we've developed a Mountain Echo Academy. This is a national best practice approach to engaging clinicians in learning from experts on the emerging best practices. And as you can see here, we've supported a number of these, not just in substance use disorder, but in other behavioral health conditions as noted here.
So there's a lot of opportunity and a lot of work that's going on. Our next section is really going to talk about how is AZ Blue helping to address stigma related to opioid use. I think, there's a growing number of resources, care, support, but stigma remains such an important topic. Dr. Chhatwal, I wonder if you might kick us off for this section.
Thanks, Christine. So I think when it comes to stigma, we know that for all of mental health and also for substance use disorders, stigma is a really important term that keeps on coming up. And the reason we really always need to talk about that is that that's one of those things that leaves a mark of disgrace. It's a reason why people don't want to share that they have a problem or that their loved one has a problem. And as a psychiatrist, whenever we're doing intakes, people will say, oh, my family member may have had some problems with mental health, but they never went to anybody, they didn't get a diagnosis. So it's the type of thing that even within families, it's not talked about, and obviously will not get shared easily in a workplace setting. So here at AZ Blue, we've committed to a program that we call Stigma-Free AZ, where our staff members and others can sign up and take a pledge to become stigma-free themselves, educate themselves about stigma, and also learn about person-first language and be able to move themselves in a direction of reducing stigma and reducing that in our workplace. When it comes to stigma, I also would like to highlight that, there's various levels of stigma that can be present. And the one that's most prevalent is self-stigma. That is me as a person feeling that I'm somehow less than because I have a problem. And so what that does for individuals is it keeps them from asking for help, even when there is help readily available. So as employers, if you're making resources available to them and realizing that your employees are not tapping into those resources, self-stigma may be the reason that they're not doing that. And then another level of stigma can be social or public stigma, and that is worrying about what other people will think. How will society look at me? How will my employer look at me? Am I going to have a negative impact because of this? And then finally, there's structural stigma, which maybe is like the highest level, which is the language that we use in our communities. It may be the type of policies we have at our places of work. And so being able to look at each of those levels and think about them when we're putting together programs can be really important so that we are addressing stigma head on. And stigma is the elephant in the room, really. One of the programs that's really helpful in addressing stigma to a degree and helping educate people in our environment is mental health first aid, and we'll talk a little bit more about it later on in the slide deck as well. But mental health first aid can be a program you can bring into your organization as a way of realizing and learning about risk factors, so it's able to do that education piece. You and your employees can learn about how to effectively communicate, and then also actual things that you can do when you see somebody in crises to help them.
And Dr. Chhatwal, I think that's so important when you talk about the different types or levels of stigma, right? So you've talked about what are those opportunities that individuals can explore when they're looking at self-stigma. You've talked about creating space to talk more openly about mental health, mental well-being, the stigma surrounding that. We saw some social media posts really highlighting others talking about the importance of mental health, focusing on that. And, I think it's important to share that as you think, and we're talking about mental health first aid, really having others join in and understanding there's a space for all of us in this conversation. And it's not just clinicians, it's not just perhaps direct service providers that are in the behavioral health space, but from a foundation perspective, we have grantees who are serving populations of individuals, and we have examples, for instance, of Girl Scouts, Cactus Pine Council, or Rosie's House, where their first focus is really how are they supporting and growing positive youth development when we talk about the Girl Scouts, or providing musical education support to youth when we think about Rosie's House. But both of these organizations have acknowledged that they're seeing the youth they serve show up with more concerns around mental health, more desire to talk about mental health, and they want their staff to have better access to information, resources, accurate information, and to feel empowered to help provide that support, connect them to resources. And so I think mental health first aid is a great example, and those two organizations are really embracing that, right? Getting their staff trained in mental health first aid, because it helps all of us. You don't need to be a clinician to participate in mental health first aid, but more people, more sets of eyes, and more sets of ears who can see, hear, and feel empowered to take action, I think is really critical to highlight.
And Dr. Wiggs, if I could just add briefly to that.
Absolutely.
The conversation is helped by practice and by learning language that is engaging and open and not stigmatizing, even when it's not intentional. And all of us continually have opportunities to learn that. And certainly those of us who are in the health professions have learned this. Even those who are trained in the mental health professions benefit from going through mental health first aid. I'd encourage everyone, if you haven't heard of this, if you haven't had this training, please consider it in your organizations. I learned a lot, and I thought I actually had experience, and I was able to apply that in my own life, in my own family, and with people that I knew outside of work as well as in work. So trainings like this really help. And Stigma-Free AZ is for all of Arizona. Any of you can actually go to that link, sign up, and we encourage you to do that. Thanks, Dr. Wiggs.
Absolutely. Yeah, absolutely. Great call outs. So the next section of conversation is really focused on how can employers better support their employees to find the right treatment, or at least have conversations around that, right? So I think this is really, as we get further into our discussion today, we'll talk about what are those resources. But I think just starting with this conversation point around how can employers, what is their role in this space? And if they're not a health solutions company like we are, right, they might feel overwhelming, and it's probably overwhelming for so many organizations, but there are places to start. So I wonder, Dr. Carroll, do you want to start us off on this section?
Sure. This gets back to this theme of best practices in emerging learning, and we all continue to learn. I think that's a really important point to reemphasize. But this is just a screenshot from the Office of the U.S. Surgeon General. But the statistics up top and the print's a little small. We won't read that, but the statistics just emphasize the importance of mental health in the workplace, and that includes substance use and challenges, perhaps, in mental health conditions that might predispose folks to develop a substance use disorder. But it's very high, and the bottom line is it's 1 or 4, 1 or 5 of the folks in our coworkers and our collaborators in work on any given day are struggling or may have had some struggles in the past. That's why there's this best practice framework that we wanted to share with you. The next slide, though, is a framework that Dr. Chhatwal and myself just put together for this slide around learning to ask. I need mnemonics. I need ways to remember things for myself. And asking is first, how we are embracing and advancing this real story that opioid use disorder and a health condition with opioid is a chronic health condition. It is not a choice, and it's not a moral failing. We'll return to this theme of what the implications are that later on in our slides. Then the S is for sharing. There are lots of available resources through employee assistance programs, resources that we'll talk about in a second through insurers like Blue Cross Blue Shield and their care management, information from state and county experts and national public health programs, and you'll see some of that information dispersed in our slide deck. And then activities such as community peer support programs, folks who have lived experience who can help and support people who are going through difficult times. And then the K is for knowing. It's really important that you all know that treatment works. Not only does treatment work, it doesn't work without treatment. And Dr. Geyer yesterday shared some wonderful statistics and evidence about the importance of medication for opioid use disorder, or what you may hear as MOUD, as a topic being discussed more in Arizona. Treatment works, and we're going to chat about that in the next few slides.
Dr. Chhatwal, anything to add there?
Yeah, I think the portion to add around the medications for opioid use disorder is that there are multiple medications available. Sometimes there are people who are in abstinence-only programs, or there are, more of a push towards abstinence. And we do know that as much as there are some rare people who can do well with abstinence, a lot of folks actually need these medications for opioid use disorder to be successful in long-term recovery. And so even recently, the government has stepped in, since it's such a big issue for us in the country and the state, that Congress actually passed a Consolidated Appropriations Act in which they reduced regulation, which rarely ever happens. And so regulation was reduced around some of these medications so that more physicians, more healthcare practitioners can actually prescribe medications like buprenorphine, which was the one for which the rules were changed a bit. And so now almost any physician, physician's assistant, nurse practitioner is able to prescribe buprenorphine with a little bit of training. And our hope is that people will start to prescribe these medications more. And then, as much as possible, employers can support people getting the right type of treatment so that they can get better. We can move to the next slide. I think the other piece to just think about is that most people who have opioid use disorder are actually not getting these medications. And so we do have an opportunity and an intervention that we're not using as much. And something I always like to point out as a psychiatrist is that, interestingly, it's not people just with pain disorders. So we think, somebody had an injury, they have some pain, that's when they get put on an opiate by a doctor, and then they might find themselves in a substance use situation where they're addicted to it physiologically or psychologically. But when it comes to opiates, we also see that people are using opiates to treat emotional pain. So they may have some sort of emotional loss that they had, or they have early life trauma. A lot of people have heard about something called adverse childhood experiences, which are negative impacts that people have had early in life. And what we notice is that their brain almost seeks these substances such as opiates, which make them feel good. And so people could be using opiates for all sorts of different reasons that aren't only physical pain related. And remembering that becomes very important as we're looking at interventions and solutions. But even for folks who develop an opioid use disorder because of non-pain related issues, the medications that we're talking about around opioid use disorder are very important and can be life-saving treatments in the long run. I think this is, again, one of those things where we want to make sure that we keep on increasing access in every setting. And instead of just leaving it to the psychiatrists to treat, part of that Consolidated Appropriations Act intention was to make it that we're really talking about these in every setting where patients show up. So all types of primary care settings should be providing medications for opioid use disorder. And I think as employers, you all need to know that, so that when you're building contracts with or developing relationships with certain healthcare entities, you can ask the questions about what their approach to opioid use disorder is. And I think these are other resources that we just wanted to share to make sure that you're aware that there's so many different communities out there or organizations in the community that are doing really good work in providing support.
Right, and if I just might add to that,
Yeah.
just briefly, this is an example of training for clinicians, for providers on medication for opioid use disorder. You can see it doesn't require days, but it does require some training. And as Dr. Chhatwal noted, that the government has opened up the ability for folks in primary care to become more comfortable getting people started. Because when people are ready to start treatment, that's the time to start treatment. And we went through a slide quickly that just shows how we're trying to engage in this, even from Blue Cross Blue Shield, partnering with our clinical community to actually offer such training, as well as help people get through sometimes their hesitancy to actually be able to initiate or oversee medication for opioid use disorder treatment themselves. If you've noticed that some of these slides, and you can stay on this one, Dr. Wiggs, these are courtesy of Dr. Villarroel from the Department of Health Services in Arizona, because this is a large initiative and you're going to be hearing about this in multiple settings if you haven't done so already. And it's part of the destigmatization of opioid use disorder inside healthcare, we should have mentioned that before, and it was some of the structural point that Jasleen made, which is some of us inside healthcare have stigmatized opioid use disorder and care, especially those of us such as myself who are not psychiatrists. Some of us have stigmatized that for too long, inadvertently, accidentally, but it's something that we all have to work through.
Yes.
Thanks, Christine. Back to you.
Yeah. Yeah. So many opportunities. And so as we continue to unpack the opportunities and unpack how we might connect individuals to resources, supports, accurate information and care, wonder if we might also share how we talked about some populations like pregnant and parenting women and families, but how can Easy Blue help young people specifically as we think about their need to get help in the opioid treatment, right? So trying to look not only at treatment, but maybe even prevention. We talk a lot about moving upstream, right? But we want to make sure that as we think holistically about individuals and communities that we serve, is there an opportunity to really target providing access to care, treatment, education to young people? So I wonder, Dr. Carroll, Dr. Chhatwal, what are your thoughts on this?
Well, prevention is so important in caring for young people. I am an adolescent health physician and pediatrician. We've highlighted on this slide just one bullet I'll call your attention to, just from some recent state survey that 40% of Arizona youth report feelings of sadness or hopelessness. The pandemic was really hard on all of us, but some of this predated the pandemic and has been unfortunately worsened and exacerbated over the past 4 years. This drives us to want to actually outreach and help and connect young people before they maybe are exposed to an opioid or need to receive other types of care. And an example of that on the next slide it's related, is loneliness. There are so many of us today, not just young people, but as noted on this slide, 1/3 of US adults are reporting feeling lonely. Some believe that loneliness, being disconnected, socially isolated, is more dangerous than some environmental exposures and various disorders, but it's certainly contributory to other conditions such as depression and sadness, what we talked about on the last slide. And it's amazingly costly, as you can see on the bottom of the slide. I want to thank actually a collaborator of ours, Pix Health, who's a company that we work with, for permitting me to share this slide and the next slide, which actually is about what we're trying to do, working together in partnership with Pix Health and with our community partners and collaborators to actually offer something that would be helpful for not just adults, but an app and a supportive structure. So this is not just all online, but it's a supportive people structure, an application that young people can use with our Medicaid plans within Blue Cross Blue Shield, and be expanding that across Blue Cross Blue Shield moving forward in the future. We're actually offering Pix Health for a number of populations, including the new platform that they actually have for young people, teens and young adults. And we're very excited about this because it's a solution. It's a way of helping connect young people who are disconnected and are feeling sad, but maybe have not developed, and we can help prevent other types of conditions.
And I really appreciate hearing that, right? What are those resources or tools out there that exist? How can we leverage innovation and technology? Another example that we wanted to share is as we talk more and understand more about the tremendous impact of loneliness and how we think about how do we create more socially connected individuals. The foundation this year will have an opportunity under the Theroux Family Trust Momentum Maker Grant focused on mental health, but this year very specifically focused on tackling the epidemic of loneliness, right? So how do we create those opportunities for social connectedness? How do we link arms with others? Because we're going to need technology. We're going to need other organizations. We're going to need other people in community to help drive the solution. And so I love hearing about all the opportunities. And for anyone joining us during this session, we'd love to, if you have examples of what you're doing, if you have strategic priorities that we've already talked about and you echo that, we'd love to hear that. If you have ideas that we haven't talked about yet, please drop that in the chat or in the comments or ask a question. We'd love to talk more about that as we round the corner towards the end of our our presentation. Dr. Chhatwal, Dr. Carroll, what else? How can we continue to offer help? What's important here?
Well, it's really important to help folks when and how they need it. And this is what we're committed to and working with you. But certainly within Blue Cross Blue Shield, insurers are committed, hopefully like us, other insurers are committed to helping families and young people when they need that help and offering wraparound comprehensive care management type services and working with community partners. And I think, Christine, you're going to chat about some of those great opportunities that we've had to do that.
Absolutely. And really the spotlight is on our community partners, because our community partners statewide are really the experts. They're embedded in community. They understand the assets of the community as well as the needs. And our community partners funded through the foundation are really stepping up to provide those needed services in those gap areas, or really augmenting what those strengths are in communities that they can leverage. And so just for those who aren't familiar, our AZ Blue Foundation for Community and Health Advancement, we have really placed a keen focus on where we can make a measurable impact in the community for all Arizonans. And so as we've been talking a lot about what AZ Blue does as a payer and insurer, a health solutions company, but we also see an opportunity through our foundation, through philanthropic investment and that collective action and collective impact partnership with others, really seeing an opportunity to make an impact. And so our flagship focus has been the last couple of years keenly targeting mental health. And so our partners out in the community, our grantees, are doing great work in one of these 4 areas. So in addition to our flagship focus of mental health, also addressing substance use disorder, some of our grantees are looking at chronic health conditions, and really a majority of our grantees are focused on health equity across the spectrum, right? So really looking at those important social drivers of health that we won't probably have a whole lot of time to unpack here during this session, but absolutely provide the underpinning for making progress towards everything that we're talking about here. And so our foundation grantees, our community-based partners, our nonprofit organizations, and our educational institutions are using dollars that the foundation is providing to really drive that impact. So again, whether it's working with women who are pregnant or postpartum, who also have an opioid use disorder diagnosis, working with those families to remain reunited or remain united, if that makes sense, really providing those supports for moms and getting the treatment and care they need. I shared some of the examples of some of our other partners who are bringing mental health first aid to the forefront. Some of our other partners are bringing teen mental health first aid to the state. Not My Kid is one of our grantees. Hopefully many, if not all of our participants today are familiar with the tremendous work they're doing statewide to really provide both treatment, prevention, education services focused on behavioral health topics. But really, when we think about young people, what are those opportunities to engage young people early on in learning, to engage young people early on who might have experienced some of those adverse childhood experiences, Dr. Chhatwal, that you talked about, but there's still opportunities, right? There's still opportunities to promote that resiliency. So I think we're excited about all of those opportunities that our community partners are bringing to audiences all across the state, and we're proud to be a part, even if it's in a small way through the foundation, or hopefully in a big way through the foundation and what we do as an insurer and a payer. I know data is really important to the conversation, right? We brought up a lot of data, and I wonder, Dr. Carroll, if you want to talk through this slide and tell us what this slide really shows us.
Sure, just briefly, this is a complementary slide to one we showed earlier for children, for those 17 and under in Arizona for fatal and non-fatal opioid overdoses. There are 2 key points from this. The first is this affects our children too in the opioid crisis. And the second is there was a big bump there in 2020 with an increase that predated significantly, as you can see, the pandemic, but that is coming down. So some of what we were doing, a lot of what we're doing is making a difference, but our work's not done because there are still, as you can see from 2022, 2023 data, I think will be released shortly. We still have a ways to go, and we're committed to doing that.
Dr. Chhatwal, before we move on to the next section, was there anything else that you wanted to add there?
I think you've covered it well. And the thing to just always remember is that, the pendulum swings, and what we really all need to do is continue to stay focused, because at the end of the day, our children are going to grow up, and whatever is impacting them today is going to be impacting employees and the larger population. So continuing to keep the focus and making sure that we're all aware of options we have to improve our health and well-being are important. And I think for employers, if their employees' children are not doing well, they're not going to be able to have engaged or present employees either. And there's, I think we'll cover in the next section all the various ways that there is help that can be received.
And I think we also talked about, in this slide, while one is too many, we start to see again, that the numbers start to decrease, and, kind of harkening back to that slide, Dr. Carroll, that you showed earlier on about hope, right? So we want to, arm ourselves with accurate information, be grounded in the data, but not lose sight of that hope and the opportunity around what we can all do when we join together. This next section is really around, so we talked about employers, we've grounded ourselves in the data, how can we best support and serve employees as they are navigating the resources with insurers, arm in arm with us as employees are trying to find support, right? So admittedly, sometimes can be really overwhelming navigating the amount of resources, right? And we might feel optimistic that there are a tremendous amount of resources out there. It could always be more, but it's overwhelming sometimes for individuals to navigate all of the resources out there. So I wonder if the both of you can help us identify where to start, where to go, where to turn.
Maybe I can start, and Jasleen, you can jump in, please. But first is, for your insurer, whether it's AZ Blue or another insurer, it's really helpful to know your benefits, and those benefit packages change. And as you can tell from our presentation, there are benefits beyond what may be actually covered in the amount of copays and things of that sort that exist. From us at AZ Blue, the message is short: please call us. We're here to help. Our teams are available to help answer questions that folks may have. Insurance and health insurance is complex. Even those of us who work in it get confused. I call internally regularly to ask and learn about my own benefits and what resources are available. Our care management teams are just fantastic, supporting our members and hopefully supporting you and your families at AZ Blue. Some of them are behavioral health specific. There's screening that goes on through all member assessments. We emphasize prevention activities, and that means care that is also supporting best practices that are non-opioid therapies. While most of the opioid crisis is being driven not by prescription medicines, but by street and illicit use of opioids, we still only want to use opioids when appropriate. And so those prevention methods and our care management teams can help with that. Transitions of care and other special type of situations are important. It's important, though, also from us, and I continue to learn this from my colleagues, that whole person care involves the whole person. And we have to be flexible around how treatments are available, like medication for opioid use disorder. There's new telehealth capabilities for whole person care for MOUD, as well as for other types of care for where people live and work. Dr. Chhatwal, would you like to add anything to that?
I think the addition of the telehealth has been a real game changer when it comes to treatment of opioid use disorder. There's still a little bit of uncertainty as to how long the telehealth capabilities will last or how they'll change. But I think just having that possibility has made it, that especially in a state like Arizona, where so much of our land mass is rural, that we're being able to get more care out to people where they're at. And they hopefully don't have to miss work as much when they can do that, and can just clock out of work, do their appointment, and clock back in, because we also know people miss healthcare appointments because they don't want to take time away from work. And I think as employers, making that flexibility available and making sure that people know that prioritizing health is important. And I always feel like leadership in organizations does carry a big burden of making that okay. So really using using language that's supportive, but also having your own behaviors be supportive. So if you're the CEO or the HR director of an organization and you're not taking time to care for yourself, then it gives the message to your employees, no matter what you say, that we don't really support you taking care of yourself. And so I think, those are some cultural changes in workplaces that can be very helpful to consider and be aware of. I think this is a part that I'm very, very passionate about, so I'm just going to jump right back in. So at Blue Cross Blue Shield and within the Medicaid group in general in the state, we have an Office of Individual and Family Affairs, which is called OIFA in short. And one of the reasons that's really important is that it actually is all about peer support. So people who have themselves struggled with mental health or substance use conditions who function as peer support. So that can be that real ray of hope where, similar to the story that you heard yesterday, it's people being able to see that, hey, there was somebody who was in the same situation as I am, and how did they navigate? And it's not about layering the peer support person's story on top of the story of the member who's being helped, but at least being able to be connected with somebody who's walked in their shoes to some degree and is able to support. And I really do think that peer support can be that initial place where it's easier to get some support, because especially with physicians and healthcare providers, there can be a little bit, even if we don't want it to be, and we can be the most welcoming, but sometimes there is a little bit of a difference in how people will present in front of their doctor. And there's a lot of cultural considerations where people want to present their best face to their doctor and be the good patient. And so they may not share the struggles that they're having. And our peer support teams can make it really welcoming and an open conversation, sometimes even more so, and a resource that we're very proud of at AZ Blue.
Absolutely.
Yeah.
In our final few moments, I know we have a bit of content to move through, but I want to encourage anyone, if you have any questions, comments, please do drop that in the chat or the Q&A box. We're going to talk about additional resources, and then we're going to talk about the opioid toolkit. And so, but let me go back here. Dr. Carroll, do you want to tell us about some of those statewide resources and what some of those opportunities are out there?
Sure, Christine, I'll do it very briefly, but the ORA line, the Opioid Assistance and Referral Line, is available, free, confidential hotline for anyone. We're really fortunate to have this in the state. It's for people, it's for employers, it's for providers. We really encourage people to use this for any questions you may have. And we want to emphasize that opioid overdoses don't need to be fatal. Naloxone, otherwise known as Narcan, makes a difference. And as was noted earlier in the presentation, there are tools that we have that folks aren't using, and bystanders, anyone near someone who maybe is overdosing, can actually save a life. And this just shows the importance of and the opportunity of bystander interventions if someone accidentally, unexpectedly overdoses. The next slide demonstrates or shows that this is from the FDA. There are opportunities to receive this, first off, over the counter and free, as we'll share in just a second. But the naloxone sprays over the counter is a picture of what that spray looks like. ADHS, and working with the CDC, the Center for Disease Control, is recommending that people on prescription opioid medications actually all have naloxone in case of accidental overdose. And this applies as well for a hospital and medical center emergency departments. And I believe the next slide just shows how Access, our state Medicaid program, is worked to be in support and aligned with that through a particular adjusted payment mechanism that hospitals and emergency departments can access, where they get a bump in their payment to care for a Medicaid member for naloxone distribution in the emergency department. We can't emphasize enough the importance of all of us recognizing that any of us can save a life on any particular day with naloxone. And a colleague of mine did this, was driving along last year, and someone was stopped at a traffic light in front of her. The car didn't move. And rather than doing what perhaps I might have done, which is honk the horn and try to drive around, she sensed something was wrong and actually went up to the car. The person was passed out. She actually had naloxone, and she saved this person's life. So we all have a role to play.
Absolutely. And that's a great segue to, we have a role, but what tools can we arm ourselves with so that we have support? We're talking about what we're doing for our own employees, but really the opportunity is to highlight the toolkit that Valley Leadership has developed in collaboration with others. I think what we talk about and what we've shared through our session so far is there have been many ways where we've tried to think about what those opportunities for collaboration, connection, leveraging resources out there, technology are, and that has been from our AZ Blue perspective. But I think the opportunity is to invite everyone joining us here and to spread the word about the opioid use disorder business toolkit that was developed through the health impact team. So Valley Leadership brought together a whole host of leaders across multiple sectors, including human resources, policy, healthcare, communications, and much more, to develop a free comprehensive toolkit for Arizona businesses that are really looking at how they can help, right? Dr. Chhatwal, I heard you talk about employees who don't make time, but I think there's so many employees that can't make time. They don't have that opportunity, right? So businesses can look at their policies and procedures to really help move away from a zero tolerance policy towards regarding substances to a more supportive culture regarding OUD. And of course, there will be opportunities across the spectrum, right? Not each organization will have the same opportunity to be as flexible as others, but really, I think the invitation is to welcome businesses to look at what their current policies are and to explore what the opportunities are to make the tool or their policies and procedures even more supportive. So this toolkit has over 100 resources that have been vetted from the most respected resources to help businesses really as they are navigating their journey and figuring out what those opportunities are to transition their policies and procedures. The toolkit has a lot of interactive features. It includes an intake form as well as different checklists based on the size of your organization, based on the readiness of your organization in terms of leadership, and really having your organization explore where you are on that continuum. It also helps provide the next steps should an organization want to take action, and there are resources in the toolkit that can help support businesses do that. So we would encourage you to share this resources with within your organization, with your HR colleagues. Please share it with other colleagues so that they can understand what the opportunity is to leverage this information and these tools. The website for the toolkit is oudbiztoolkit.org. I believe we're going to drop it in the chat as well, so you can easily grab that. But we want to make sure that you knew that that was available. Please look at the website. Please look at the resources. See what those opportunities are. I know we did that here at AZ Blue. We reviewed our policy that honestly needed to be reviewed. It had been reviewed in quite a while. There were so many opportunities to infuse person-centered language to really ensure that there was alignment with supporting individuals who might be struggling with substance use disorder. So that we moved the language to understanding that this was a disease and to really treat employees with that opportunity to support their continued treatment and recovery. So many options in the toolkit. We invite you to check that out. I'm going to welcome Paige back and see if, Paige, are there any questions, any comments that have been shared by audience members that we want to address before we wrap today?
I think we're just waiting to see if there are any questions. Just for the audience, for a business that is in the process of going through their policies, who exactly should they reach out to at Blue Cross? Because I know there are some different departments, so just making sure that they know exactly who can be that point of resource.
Yeah, we'll make it easy so individuals can reach out to me, and I will make sure that I connect you to the right individual within our organization. So Christine.Wiggs at azblue.com. Happy to be that initial point of contact. And then Paige, I will make sure that folks get connected with the right resources within the organization.
Perfect. Thank you, Christine. Any other
Absolutely.
questions from the group?
It seems like there's a question in
Oh,
the
there we
Q&A,
go.
but yeah, I just wanted to add, I think, for employers, it might be good to start thinking of OUD when you're thinking about policies and say, would I have the same policy if somebody had cancer? And to question that in some way, because cancer was very stigmatized a few decades ago and we've moved far away. So I think just as an internal barometer of how you're looking at things.
That is a great way to think about it. Whenever we talk about this, we really want to make sure that people do look at these things equally in terms of the severity and the impact on the individual. So that's a really great way to position it. Thank you.
Yeah.
And we encourage everyone individually through your organization. Don't worry, we won't knock on your door if you take the pledge, but please take the pledge. All of us have an opportunity to learn and work together and continue to learn how to help each other get through difficult times individually and as a society. Thanks.
Absolutely. And I, in the last minute, just want to thank each and every one of you who've joined us during this session today to think more about the opioid epidemic, to understand its impact, to understand that there are resources and tools out there to leverage the business toolkit, and ultimately to have hope. There is opportunity as we continue to work together to create that collective impact and action. I want to wrap by thanking Valley leadership for welcoming us and inviting us to have this conversation with all of you. And I also want to thank Doctors Carroll and Chhatwal for joining me today. Thank you so much, everyone. Hope you have a great rest of your day.